record. All right. So here we are today with Dr. Vonetta Dotson, who is, among many extraordinary things, an associate professor at Georgia State University in the Department of Psychology. Is that what you all call it? Yep.
Yeah.
And I met Dr. Dotson, whom I will call Vonetta because I can't help it, if that's okay.
Please do.
When we were working on the Committee on Aging for the American Psychological Association, and Vonetta really does some really cool work in neuropsychology, and I know a lot of you are interested in assessment and are neuropsych nerds, but we're also going to talk today about some of your work with health promotion and your company, CerebroFit. So let me start us off. My first question for you, Vonetta, is tell us about what you do and how it relates to aging.
Okay, awesome. So I do a lot. That's always how I introduce what I do. I consider myself a scientist practitioner, so I do both research and clinical work at the intersection of aging and neuropsychology. So breaking that down, my specialties in how things like depression can have a negative effect, and things like exercise can have a positive effect on the brain as we age. So what are the modifiers of brain health over the lifespan? And I really have taken more of a lifespan approach now, trying to understand how what we do earlier affects the aging process, and trying to reduce the risk for dementia, reduce the risk for late life depression and other conditions that are more likely to happen as people get older if they haven't lived a lifestyle that promotes a healthy brain. So clinically, I specialize in older adults and doing neuropsychological assessments, particularly trying to differentiate depression, anxiety, and other psychological conditions from neurological things like dementia. And then research-wise, I really have gotten quite interested in health disparities in cognitive and brain aging and sort of what we can do about that. So again, I've kind of taken this late life depression interest I've had for years and mixed that with health disparities and trying to understand how we can prevent certain types of depression that are more likely to happen, particularly in Black older adults, by promoting healthy behaviors. So it all ends up coming together. On top of that, I do teach on various classes at Georgia State related to that. And then, as you mentioned, I have this company on the side that we can talk about later that is really the practical extension of the work that I do in the lab.
Absolutely. So I'm going to dig a little deeper into some of those things that you said first, if that's okay. I'm wondering if you could tell us like a really broad overview of what are some of the distinctive factors in neuropsych testing between sort of that more depression, anxiety in older age, or it doesn't have to be, but in age, and then dementia. Just broad strokes.
Yeah, broad strokes. So, I mean, in general, we know that depression, anxiety, and other sort of mental health concerns can contribute to problems with attention, with memory, with executive functioning. But we look for certain clues to distinguish that from a neurodegenerative process, such as Alzheimer's disease. And so generally speaking, we want to look at the timing of cognitive impairment versus the mood or anxiety problems. We look at the severity, because the kinds of cognitive problems you see due to depression, for example, are usually not going to be as severe as what you see in dementia or even in sort of mild cognitive impairment in many cases. So we look for sort of patterns of things, but I will acknowledge that sometimes I'll see someone and say, they seem to have mild cognitive impairment. I'm not sure if it's due to depression or due to sort of an incipient dementia. So that might require them to have a follow-up after their mood disorder has been treated. So it becomes this sort of puzzle you're putting together that can be tricky at times, but I find really fascinating. And I like being able to help people identify if there's a treatable cause for their cognitive dysfunction.
Very cool. And you also mentioned that there are health disparities for African American older adults with depression, and I would assume also dementia, but can you tell a little bit more about like how that has become or what that might look like for people?
Yeah, absolutely. So what's interesting is that when people are younger and young adults, you don't really see the same disparity when it comes to the prevalence of depression, although the consequences of depression are always greater in ethnic minorities. But when you get into late life, you do see a higher prevalence of depression that seems to be this kind of combination of accumulated race accentuated stressors, health disparities in vascular disease, other social determinants of health that sort of impinge upon Black older adults. And it's an interesting example of intersectionality, where you have sort of the aging process, but then you also have that minority status. And cohort differences when you think about African American older adults now and sort of what they lived through. And not to go off on too much of a tangent, but then having some of that reactivated, over the last year and a half, as we've had an overall societal increase in consciousness and awareness of the disparities that have been there across society. So I always say it's not anything new, but it's just when it's sort of reactivated, when the conversations are happening constantly. And so you're in some ways reliving, past discrimination, past trauma. So all of that can contribute, I think, even currently right now in 2021 with what we're seeing in sort of health conditions and mental health conditions in African American older adults. Thanks for your question. Sorry, I feel like I went on a tangent.
No, that was exactly what I was hoping. So, we've been talking a lot about life course theory and cumulative advantage and disadvantage in our class. And I think that's a perfect illustration of how, the cultural, socio-historical milieu plus those like events that are very specific to either a cohort or an individual can just push that wellness trajectory. When you think about like my wellness dipped when I was in my 20s, because it was during the civil rights actions and desegregation of schools and how that affected education. And then you see it again when you have a similarly racially charged and very like negative and traumatic experiences for that like community and cohort of individuals. So that's really interesting to me anyway. So hopefully it's a great illustration. You just did a great job for me.
Thank you.
Well, I'm wondering if this is sort of a personal question about your clinical work. Have you been fairly active over the pandemic, or have you been, kind of not seeing very many folk? And if so, have you seen different things happening in your clinic over the pandemic?
Yeah, so that's a good question. So I have been less active, but still active during the pandemic. So I did shift to telehealth. And so after the first couple of months of the pandemic, I did start offering services through telehealth. And I took a little bit of time actually, because I wanted to make sure I felt comfortable doing that, because I do think that abrupt shift from in-person to, tele-assessment came with challenges, some of them ethical, that I felt like I needed to make sure there was enough information for me to feel comfortable about what I could give through the telehealth format.
Oh, sure.
So with that sort of caveat, I saw, a handful of cases, honestly, only one or two a month for the most part, but enough to still be seeing people during the prime part of the pandemic. The pandemic still happening, obviously, but gotten better. But I have gone to in person now that I'm vaccinated, but still do it safely in distance and with masks. But I give people the option now. So having said that, yeah, it's been interesting to see a lot of variability in kind of what people are presenting with, because, I've seen people from multiple, from different races, African American older clients, as well as people from other backgrounds. And there's a common theme of just seeing how people are feeling the stress of the past year, and then trying to separate out what's going on with that versus what's going on from a neurodegeneration standpoint.
Yeah.
And then they also can be related, because stress can start to exacerbate what was already going on beneath the surface. So I find it to be an extra challenge of trying to sort of sift out different things that are going on in our country. And, people, as an example, someone who dealt with multiple COVID-related deaths and was having pretty severe depression, but at the same time, looking back at the history, seems to have had some decline going on beforehand. So trying to figure out how much of this is just what was already happening, how much is that this person is just in the middle of like really tremendous grief and lots of stressors over the last few months. It's been challenging, but also I think a period of opportunity, and trying to help people. I really want people to feel empowered to try to improve where they are the best that they can, even if they're having some decline, even when they're having multiple stressors going on.
That's really interesting, when you think about like how that affects assessment in particular. And I would guess like therapy and diagnostic interviews and trying to like figure out how
Mhm.
much of this is like a historical ongoing process of whatever you're in here for versus like exacerbated and or new.
Mhm.
That's a huge challenge, and more power to you, man. I would be like, huh?
I do that internally sometimes, but then I go and like figure it out later.
Yeah,
Sometimes in the
same.
moment I'm thinking, oh my gosh, there's so much. I have to like sit and like really like think through each part and then think about the literature. And so, but yeah, I have that response sometimes too.
Yeah. Do you have students in your who are part of your clinic, or are students like your assessment clinic, or are there students in your research at school?
So the research for sure, I have a lab of like fabulous students and I like adore them. They're so good. And so, yeah, I have 6 graduate students and a postdoc right now. So I have quite a big
Wow.
lab.
Yeah,
Yes.
that's great.
Clinically, so I actually kind of run 2 clinics, but only one's been active. I have the clinic that I run through my business, CerebroFit, which is where I've been seeing people during the
Okay.
pandemic. At Georgia State, I actually I technically sort of direct a brain health clinic, but it really is one of those, if we happen to get a referral, we take it, but we don't go out of our way to kind of
Okay.
connect
Yeah.
necessarily in that way, mostly because the psychology clinic at Georgia State mostly focuses on the earlier parts of the lifespan.
Oh, sure.
So during the pandemic, we just kind of let that lie. And then if someone called, we were willing to see them, but people were mostly kind of staying away, but that will get started again. So for that clinic, I do have students involved, but just not in the past,
Yeah. I was
15 months.
thinking I was thinking how cool it will be for them to take out these experiences from this like kind of crap storm of a time for them in a lot of
Mm-hmm.
ways, but kind of this
Yeah.
learning lab that we have available to us is great. And I'm sure that the students in that are watching this are thinking, yeah, there's been a lot of changes in the last
Mm-hmm. Absolutely.
16 months in the
Yeah.
clients that they've seen. But so you mentioned CerebroFit. So let's talk about
Mhm.
that. That's one of those really particular interests you've had in prevention, right?
Absolutely.
So tell us about your company and why you started it.
Yeah. So my company really came out of me designing the place that I wanted to send my patients, my clients to. So basically, I've spent 20 years now, if you include graduate school, working with older clients doing neuropsychological assessments, and I've always been frustrated when I feel like I do this assessment, I have my report, I have a laundry list of recommendations for them, and then I send them 5 different places to go and do those things. So I say, hey, to kind of boost your brain health, you should exercise, you should eat well, go to therapy for your depression, all these things that I'm saying. But it's a lot. I assume it would be overwhelming for anyone to be like,
Mhm.
okay, well, now I have these 4 different appointments with 4 different providers in 4 different places that I need to go to try to do what this person's telling me to do. And so I always wish that I could send someone one place to get everything done and not have to do so much coordination and driving back and forth back when we did things all in person, et cetera. And so I just got the inspiration a few years ago that I had this thought of, one day I should try to make the center where it would be one stop for brain health. And so someone could come and see me, get the neuropsych assessment, but also have sort of in-house a place to be able to, get the exercise, see a nutritionist, get therapy, have a sleep specialist, all these things that we know are good for the brain. And so I decided to do it. And it's been exciting and challenging. I officially launched services in February of 2020. So, yes, exactly. So that means I have the COVID business. Yes, and the only sort of positive that came that about this whole process is that I already knew that I needed to offer services online because right now we don't have a brick and mortar building because that
Okay.
takes funding. And I'm trying to, I knew I wanted to first start off doing things virtually and then work on getting investors or, NIH has small business grants, those sorts of things to be able
Yeah.
to get the funding for really expensive real estate in Atlanta. So, fortunately, we already had planned on that part, but it still made things challenging. People just went underground for a while. They didn't want to talk to anyone. They didn't want to have medical appointments. No one wanted to exercise during COVID.
Yeah.
People who were already exercising maybe continued, but no one wanted to start exercising during COVID. So there were still challenges in trying to sort of bring in business, but I'm really excited that we have been able to do that. And so, yeah, so right now it's, again, we've switched now to being able to offer some things in person. I have an office share that we use for most of the appointments, and then our trainer has a gym that he's able to work out of to see clients, which is really great. But yeah, so we have a personal trainer, we have another clinical psychologist who does most of the counseling, we have a health and wellness coach, we have a dietitian, and I am right now screening potential sleep specialists who can help with that aspect of things too. And so that's what we do. We try to, if I see someone or someone comes into another service because my team kind of bringing someone in, we let them know about all the overall benefits of having multiple lifestyle behaviors to promote brain health. And in that way, we're able to, offer people packages like, okay, you can do training and nutrition, and then you get this sort of discount. And it's a way of being able to, again, emphasizing prevention, like you said, like ahead of time, but also people who already have mild cognitive impairment, or in some cases even mild dementia, who can still benefit from some of these services, that it's not too late to try to maintain your level of functioning longer, or to even improve your functioning, particularly if you do it sort of earlier before the disease process takes hold. So yeah, that's what we do. I'm really excited about it.
That is so cool. I remember when you were having the brainchild of it and thinking, this is such a great idea, because if you've ever done assessment in like with older folk, you are going to have like the recommendations list. And it usually is, like you said, a bunch of providers and a bunch of people. And, we don't always have time to be case managers on top of everything else. And they may not have one. And it's difficult to like send them off and be like, please follow through. So this is a great idea for everybody. I mean, huge accessibility issues that can be addressed within just a one-stop shop.
Thank you.
We've been talking a lot about ageism in class, and one of the things that strikes me is that I wonder, do you ever get pushback, or is it a hard sell on the you can make a change, you can make this different? Because we have that you can't teach the old dog new tricks, and older people don't change. What's that been like for you?
Yeah, sometimes I'll get really like skepticism, because this is kind of going against what people think. They do have it in their mind that some things are just going to be inevitable. You get older, this is what happens. And trying to say, well, no, actually, number one, there's a lot of variability in aging. So not everyone declines at the same rate, in the same way, in the same type of skills, and you can do something about it. And I really try to flip it into making it about empowerment and saying, so it's an easier sell when you say, I'm not trying to give you a long list of things to do. I'm saying, hey, you can control more of your destiny than you realize. You don't have to have this sort of negative image in your mind of what aging is going to look like. So, I get people in their, like, let's say in their 50s, and they have a parent in their 70s who have dementia. So they'll come and see me because they're like, okay, I'm starting to get older and I don't know what's going to happen to me. And I'm so scared of that. And in that case, a lot of times they actually are more open because they're thinking, can I do something to try to lower my risk? And so that's helpful to be able to say, yes, absolutely, let's talk about this, and give you, and not give false hope, right? And we can't guarantee someone's not going to develop problems, but certainly that they can do something to benefit, to have, whether it be buying more time or having more stability or what have you. So in that case, sometimes it can be a little bit easier, but other times, particularly when someone has already started to decline some, there's this feeling of like, either nothing's going to help or I need some medicine. So can you give me medicine? And I say, well, number one, no, I cannot. I'm, not a physician. I'm not that kind of doctor. And then number two, actually the research shows that the best thing you can do are the lifestyle behaviors. So people kind of have this like, whoa, hold on, wait, what? I wasn't expecting that. So I find it fun to educate people when they do have that, sort of slight pushback. Usually it's not so much negativity, but more, are you sure about that kind of thing? And so I have to really sell how much the research shows. And I get a little nerdy and I get all excited about it. And they're like, you seem really enthusiastic about this. I'm like, because I believe in it. So, and that helps too. It helps to sell it.
Yeah, I think so. I mean, you're also instilling in them like hopeful and positive views about aging, which, we know is
Hmm.
highly also important and protective. So that's all in good work.
Yes, I do love
So,
it.
why do you love it? How did you get into aging, Vanetta?
So I got into aging. I got into aging actually because of Michael Marciska,
Ah,
who is, the students may or may not know, just an amazing, wonderful cognitive aging researcher who was quite well known and was he current Division 20 president or was it last
just
year?
passed, I think.
Just
Just
passed.
passed.
Okay,
Yeah.
just passed. President. He was the co-chair of my dissertation in graduate school, and
Mm,
I consider him like my mentor. Long story, but he mentored me more. He was my
yeah.
biggest mentor in grad school and beyond. And so what happened is that I always had interest in depression and brain. And so I had, even as a post-bac, done work in depression. And
Mm,
then as I was thinking about dissertation ideas, Michael suggested, oh, have you looked at the literature in late life depression? Because you might find that interesting because there are some differences in terms of like cognitive, deficits associated with depression in young and old. And so I thought, oh, that's a good idea. So I started reading and I was like, oh my gosh, this is fascinating. Oh my God, are you? And so all of a sudden my mind's like going like, okay, so this might explain some things. And maybe because of the brain changes that come with aging, that might be some reason why you see some of these symptoms in older adults. And then what can you do about it? So I just had, I don't know, like a sort of like nerd moment of like,
yeah.
I remember this one particular day reading a bunch of articles and being like, I have to learn more about this. So Michael was very happy when I told him I was interested, and he suggested that I look into the gerontology certificate that was offered at University of Florida where I was. And so I applied and then was accepted into the certificate program, and the rest is history. I mean, the more I learned about the full context of aging, so not just late life depression, but just an aging and aging individuals, the aging process,
Mhm,
social aspects, biological aspects, I just found it to be such a perfect complement to my neuropsychology training.
mhm.
And that's it. Really was just a match made in heaven. I couldn't go back once I learned even a little bit about aging.
That's my hope, is that there's a hook out there for everyone and they
Yes.
find it. Well, thanks to Michael, because if we didn't have you, we would be hurting in the field,
Aw.
but,
Well, thank
for
you. I
many
appreciate that.
reasons.
Very much appreciate that.
So I'm curious to think, as an expert in the field, what do you see as some of the biggest challenges that older adults face, either that you see or in your work or in general?
Yeah. Honestly, one of the biggest challenges I see is the lack of preparation of
Mm,
the medical and mental health field to treat them and
yeah.
to work on it. So, I mean, this obviously having been on Committee on Aging with me, that there's a shortage of people who have the specialty training to work with older adults.
Mhm.
And I really am big on trying to sort of prime the pipeline, as I know you are, and trying to also educate people who are already in the field about sort of cross training and that sort of thing to
Yeah.
be able to be prepared. And for people to realize that you do need specialty training. You can't just say, oh, because I'm a journalist, and so that means I can do anything. I'm like, well, it's kind of like a physician. Your primary care doctor might be okay for your initial screening, but then if you have cancer, you don't want your primary care doctor to be seeing you. You
Yeah.
want oncology to see you. When you're a kid, you don't go to just a general practitioner. You go to a pediatrician.
Yeah.
So I think that in that same way, realizing that different stages of lifespan might need some specialty training, I think is really important. And so I think a big challenge is going to be for this field to be prepared to work with people. So that's a little bit more of a field question. I kind of flipped it to talk about the
No,
field and not about
that's totally
the
fine.
population. But also, I just think sort of managing this idea, dealing with this idea of prevention. And so what I mean by that is that a lot of people feel like, okay, it's too late. If I'm already in my 60s and I had a certain lifestyle, like what can I do now to try to like go into my 70s, 80s, beyond even, to
Mhm.
try to have the healthiest life possible. And so I think just education, like I guess getting the word out about what can be done, even in later decades of life, that it's not that you have to say, well, it's all over. Everyone's talking about all these things to do when I'm younger, but I can't do that now. But saying, well, no, actually, there's still some things that you can do and you can still live life fully.
Yeah.
I wish I could remember what it was called, but there was a sort of random little short video by, I think it was by Pixar, and I know this is random, sorry, but it was I have Disney Plus, and I thought it was really cute because it showed this old, it's like a 10-minute video, 10-minute old movie, and it showed this older couple that initially, one of them was just, I think he was in a wheelchair, and so he was just looking very sad all the time, just kind of sitting at home, not doing anything. And the wife was like lamenting, thinking about their old life and how active they were. And so the short version of the short story is that at the end, it shows them basically embracing what they can do then. Like he's actually, they're still out there listening to music and dancing. They're still like living, and it's kind of realizing that, hey, maybe there's some physical limitations now, but I can still do other things. Maybe I have slowed down some, but I can still go out and like really embrace life. And so I find that kind of thing super inspiring and want other people to see that too, that whatever changes happen, there's still so much you can do to live a full life throughout your lifespan. That was a long answer, but
no, that's awesome. I think it's important for us to hear too, is because the selective optimization and compensation theory about like, you will have limits at any point in time in your life. You may have different ones or more of them at later ages, but you're always compensating and optimizing your environment to compensate. So why not when you're there? And there has to be a spectrum of ability that you're in, and you can even widen that some, and most of it's in your mind, right? Most of it's in your mind, which is where we all come in.
Yes.
Is if you can sort of get that mindset shift and then that motivation up and that first try, then I think a lot of things can change pretty big for people. So
absolutely
agree. So my last question is more of an age liberation or liberation psychology. So we're talking a lot in class about ageism and structural ageism, cultural ageism, interpersonal and embodied ageism, and how that really impacts us across life, but in particular when we internalize some of that stuff and experience those structures that are more ageist, like healthcare systems or workplaces, etc. And I'm sure that it affects what you do and what I do and what we all do and potentially who we are. What do you think that it would look like if that either wasn't there or it was significantly less, either in your work or for older adults? What's age liberation like?
Yeah. Well, so that would be obviously like the best thing ever if we ever could get to that point. I really think that most of what I've been talking about, I think would be sort of used more or utilized more if there weren't that, if there were some, liberation there. So what I mean by that wasn't very clear. I think that right now, a lot of times people don't have motivation to do some of the healthy lifestyle behaviors because they think it's not going to be helpful anyway. In other words, they're thinking, well, what's the point? If I'm going to get older, that means I'm going to get dementia, because people think that, even though it's not, true for most people. And so there's this sense of like resignation. And so I think that if we could get past these ageist beliefs, that people would have more hope and they would feel more empowered. And so then it becomes, so healthy behaviors are hard anyway, so let me not be unrealistic, right? There's a reason why gyms empty out by February when they're full in March. So I'm not trying to say that would solve all problems, but I am saying that there are some of the things that, that we know are really helpful and good and that promote healthy aging, that if people felt hopeful that they really could age better because they saw successful aging, they saw all the things that can be done and how life can be enjoyed, I think that they would have more of a sense of empowerment to do those things. So in a strange way, I was like, well, my business would really boom if we could get past ageism because people would believe in it more.
Let's do it.
I know, right? But aside from that, no, I really do think that even what we see in terms of like loneliness and isolation and depression, anxiety, a lot of things that we see, so much of it ends up being impacted by this internalizing of these sort of negative stereotypes that are out there about aging. What obviously would be addressed if we had a healthcare system that wasn't as anti-age, if we had work systems where people could work longer if they wanted to without being pushed out the door, and where they had whatever accommodations might help promote them being able to do it longer. We know that a lot of people experience cognitive decline after they retire, and a lot of it's because they're not keeping their mind active, they're not having that social contact. And so in reality, and people can do things to counteract that, right? I'm not trying to be overly negative. People can volunteer and do things to stay active, but it becomes harder on the individual
for sure
when they've been, before they wanted to, pushed out of a work setting. So all of those things would just be so much different if we were in this sort of liberated state. So there's a lot that we could do, and I have hope that we'll get closer to that, even if we can't get there fully.
I'm with you. And I think I've seen, like, even maybe in the last decade, where I've really, there has been slight shifts in like the media. And I mean, obviously we had like a crap storm from COVID, and people came in OK Boomer and, Boomer Remover and those things. I mean, we had that. But I do think that there's been a more age positive movement happening. And you do see more age positive kind of media things happening. Maybe it's with more voices. You have like the Carrie Fishers, the Helen Mirrens, the Meryl Streeps being like, stop already, and Grace and Frankie. I mean, we have a few more. So there's a movement. You can kind of see it if you look in pop culture, that it's growing a bit, but we definitely have a long way to go.
Yes.
But we're going to
start there somewhere. We're going to get there. Absolutely.
That's right. Well, Vonetta, Dr. Dotson, thank you so much.
Thank you for having me. It's
to
fun.
have you.